Hello, today we're going to talk about the history of vitamin D and how we got here. Oftentimes when something doesn't seem quite right, it's very instructive and helpful to go back to the very beginning to try to figure out what happened and how we got to where we are. Cod liver oil had many uses for centuries, including tanning of hides, fuel for lamps, it was in liquid soaps, and flavored food in northern European cultures. Cod liver oil was also used therapeutically in poultices, salves, and ointments. By about the 1830s, cod liver oil was used to treat tuberculosis, rickets, malnourishment, osteomalacia, and some eye conditions in Europe. Cod liver oil contains vitamin D. Sir Edward Melby was a British biochemist and nutritionist who searched for a dietary deficiency that caused rickets. In 1919, he fed a group of dogs a restrictive diet exclusively of oats. He inadvertently kept the dogs indoors where they got no sunlight, and they all developed rickets. He then cured the dogs of rickets by adding cod liver oil to their diet. Later, scientists discovered that cod liver oil contained vitamin D, and it was so named that because it was the fourth vitamin to be discovered. England took swift action, leading to a nationwide response which made cod liver oil a staple supplement for children and created food fortification policies and wartime nutrition programs during World War II. The disease of the day in America was also rickets. So rickets, again, is a childhood disease caused by vitamin D deficiency, which leads to weak and deformed bones, bowed legs or knock knees, delayed growth, bone pain, dental problems, and muscle weakness. Now, at the turn of the 20th century, rickets was rampant among infants in northern cities in the United States, and it disproportionately affected black children. Here are some pictures of some of the children affected by rickets. In the center, we see the knock knees. In the lower left, we see the bowed legs. Lower right hand, we see the bumps along the growth plates of the wrists. And then in the upper two images, to the left and right, we see the sunken in, caved in rib deformities. Now, Dr. Alfred Hess, he was an American scientist and pediatrician in New York. He determined that rickets could be prevented with cod liver oil or exposure to ultraviolet light. He ran a study in the Harlem Hospital, and he had two groups of infants, mostly black, between 1919 and 1921. Now, the number of children enrolled in that study was 48. He gave 1 teaspoon of cod liver oil, which is about 400 IUs of vitamin D, daily to one group of children, 32 children. The control group did not receive cod liver oil. That was 16 children. None of the cod liver oil group infants developed rickets. More than half of the control group infants developed rickets. Hess did a similar study in 1922 with the Italians in the Mulberry District with similar results. After that, he published this article in the American Journal of Public Health, and I'll draw you to the last sentence where he says, "The time has now come to consider what steps must be taken to make this knowledge available for all mothers in large cities and to induce them to carry out the necessary prophylactic procedures." So what was the strategy? City health departments provided cod liver oil free or at low cost. Public health nurses and pediatricians administered cod liver oil in schools, clinics, and child welfare centers. The American Medical Association endorsed cod liver oil as a safe and effective method to prevent rickets. Food fortification of milk with vitamin D began around 1933. There were posters, pamphlets, and parenting guides promoting cod liver oil as essential for strong bones, teeth, and disease resistance. There were public health messaging slogans like "a teaspoon of cod liver oil a day keeps rickets away." Then the first recommended dietary allowance, RDA, for vitamin D for Americans came in 1941 and gave the value of 400 IUs. Now, fast forward 30 years, 1971. A group of scientists out of Washington University Medical School decided they wanted to determine what an average serum level of vitamin D was in the population. They took 40 healthy volunteers and 8 really 10 lifeguards. Now, race was not mentioned in the study, but in the 70s, I would assume that the participants were probably all white. But what they found was that the average vitamin D level in the 40 volunteers was 27.3 with a range of 11 to 55. The average vitamin D level in the 8 lifeguards was 68 with a range of 53 to 79. So they determined that normal, quote unquote, vitamin D is 27 nanograms per milliliter, which was found in the sun-shy volunteers, and not the 68 nanograms per milliliter found in the sun-exposed lifeguards. The problem with this, an excerpt from Feldman and Pike, humans did not evolve in today's sun-shy culture, so normal with respect to circulating vitamin D concentration should not be defined by the current average or median population concentrations. The vitamin D dietary recommendation at the time, again, was 400 IUs per day, and that was established in 1941. Again, that was derived from the observation that this amount of vitamin D activity found in a teaspoon of cod liver oil was sufficient to prevent rickets. When you look at this 400 IUs on a per kilogram basis, you give that to a newborn, it will result in a serum vitamin D level in the mid-40s. That same 400 IUs in a pregnant woman would only result in a serum vitamin D level in the 15 to 25 range. So it's estimated that to get the vitamin D level of the normal volunteers at 27 up to the level of the sun-exposed lifeguards at 68, it would have required about 6,000 IUs per day. One notation at the end of the article did state that it is of considerable interest, however, that we observed a marked elevation of 25 hydroxycholecalciferol levels in subjects who had heavy exposure to sunlight. Now, it either didn't occur to them that the lifeguards' vitamin D levels actually fit better with how humans evolved, being sun exposed for many hours a day, or they knew better than to go against the government's established 400 IUs per day recommendation. Now, in the early 1900s, scientists believed that vitamin D only really affected bone health and cured rickets. Scientists learned that vitamin D was a hormone in the body in the late 1960s. Anthony Norman was professor of biochemistry at the University of California and is one of the world's foremost experts on vitamin D. In 1967, Norman's lab discovered that vitamin D is converted into a steroid hormone by the body. In 1971, the Norman lab reported the chemical structure of the active form of vitamin D to be 1,25-dihydroxyvitamin D3, which is what we call calcitriol. So as far as our current recommendations, our recommended dietary allowance, it was again 400 IUs per day for everyone up until 2011. In 2011, the National Academy of Medicine actually did a review of the literature only related to bone health. And they evaluated studies of bone mineral density, calcium absorption, and fracture risk. And then they raised the RDA for vitamin D a smidge up to 600 IUs for most people and 800 IUs if you're over 70. My primary thoughts is that we've known that vitamin D is actually a steroid hormone and has both autocrine and paracrine actions in the body and affects many more tissues aside from bones. And as it turns out, bones are the bare minimum in terms of the amount of vitamin D to have sufficiency for bones. You definitely can be sufficient when you're in the 30, 20 to 30 range. But for these extraskeletal benefits outside of the bones, as it relates to your immune system, cancer surveillance, inflammation in the body, lower risk for many different diseases, it occurs at a much higher level than that 20 to 30 nanograms per milliliter range. So to summarize, cod liver oil was used for centuries and recognized as a treatment for rickets and other diseases due to its vitamin D content. Scientific breakthroughs in the early 1900s linked vitamin D deficiency to rickets, and that led to public health interventions like supplementation and food fortification. Key studies showed that 1 teaspoon of cod liver oil a day in sunlight helped prevent rickets. The vitamin D recommendation of the RDA was set to 400 IUs per day in 1941. However, our modern understanding is that vitamin D is now known as a hormone with both autocrine and paracrine actions in the body, and it's essential for more than just bone health. However, our current RDA is set to a very low number based solely on bone health. And if you have not watched my ancient history as it relates to vitamin D sufficiency video, watch that, and it'll also help you understand how vitamin D sufficiency was a key driver in lightening skin pigmentation over the centuries.